I'd like to start before to call Muriel, who's already here, Crusoe, difficult name, who is going to talk about PDLA. It's with you. Thank you for being here with us.
Thank you, Valeria. So, just to present you, I'm a dermatologist. I come from Belgium. I'm the vice president of the French Society of Laser and Dermatology. And I choose to talk about PDLLA, so you can laugh because in Asia you have it for a long time. But for example, in Belgium, it's new for us. We had PDLLA only since January. So we discover it. So first, and I have no disclosure for my presentation, just to discover, but I buy my product. So why the excitement? So PDLLA is the fastest growing biostimulator category of the last 2 years, with a wave of new products across Asia. So Europe and also South of America. And it's the same family as PLLA, but not exactly. And we will see why. So we can inject it on the mid-face volume, for jawline, for nasolabial fold, for skin quality, and off-face area as chest, neck, and hands. But it has a different handling, so it's a porous, spongiform microsphere, so it's different reconstitution, and the injection behavior and tissue interaction is not the same as PLLA. So if you want to compare here, so the first generation of PLLA, it was like a sheet, irregular and angular fragments. And PDLLA is a spherical but smooth surface. The size of the particles, we have 49 micrometers. For PLLA, it's 20 to 60 micrometers for the PDLLA. And one is dense and solid, another one is spongiform, and because it's spongiform, it's important to see the difference. Look here on this picture. So the new generation of PLLA is more regular, but it's not smooth. And you can see here the spongiform aspect. And then from this architecture, you have a cell colonization, you have a neocollagenesis, and it's stable tissue replacement. What is the mechanism of action? So with PDLLA, we have a cellular cascade. So if you see here, when you inject your PDLLA, so you will have then an activation of NFR2, then macrophage type 1 to macrophage type 2. We have an release of interleukin 10, 4, and TGF-beta release. We have a fibroblast activation, then neocollagenesis, first type 1, type 3, and then type 1, and extracellular matrix remodeling. So when we see here this picture, the tissue induction, so defining concept, it's a formation of a new organized tissue, not only around the particles, but also inside, because it's porous. And you see at the beginning, you have first a surface colonization. Then you will have an interstitial growth from week 4 to week 12. And from week 12 to month 24, you have intraparticular colonization with a mature tissue. Here on this picture, you have histological evidence of tissue induction. You can see on the first from Mason's trichome at week 12. And in immunofluorescence, you can see the macrophage type 1 and then macrophage type 2 markers. And here you can see the inflammatory infiltrate, not only around, but also inside. Volumetric kinetics, so what the patient sees, what versus what is happening. So it's important to warn them, because at the beginning you will have an effect, but when the carrier will disappear, you can say, oh, I don't see anything. But it's only after that you will have an improvement with your neocollagenesis. So we have to wait, because we have an idea from week 2 to week 4. And it's important to say that to the patient. And then so you have a visible improvement, the nadir, and then the stable result. So we have several products. So we have Estetifil, Powerfil, Juvelook, Lenisna, and what is different between these kind of products? Some have CMC carrier, and the other one have HA carrier. So how to choose? So I create an algorithm, for question algorithm. First, will you choose to treat face or body? For face, for body, for example, you will use Powerfil, the most concentrated particles. And for volume or quality, if you choose volume, you will have an immediate volume needed. You can use Estetifil or Lenisna. If you only want to treat quality, so you can choose Juvelook, which only PDLLA when you use for mesotherapy. What are the clinical indications by anatomical zone? So for the mid-face, so we will use Estetifil or Lenisna. For the skin booster mesotherapy, you can choose Juvelook. For teardrop, it's only Juvelook. It's the only one who has the device. And for neck, décolleté, and hands, you can use Juvelook, Powerfil for body, or Lenisna, but also for off-label emerging Lenisna or Juvelook for zygomatic ligament, for acne scars, so we have also good results for that, and papular rosacea. So it's important to reconstitute correctly your product. So don't forget that you have a diluent volume, you have a pre-hydration, so it's important to when you prepare it. Then you put it in your vortex, and it's necessary to wait 30 minutes with to move it, and then you can add local lidocaine, and you inject within sessions. You use it within sessions. You can use needles or cannula, and you choose your plane. It depends on what you want to treat. We can also combine PDLLA with lasers and EBD. So for IFU or for microneedling, you will use with Juvelook. We have fractional non-ablative laser, PDLLA, so you have an improvement of your texture and biostimulation. Radiofrequency microneedling, Mirajet, and then HA filler earring. So, but it's, oops, sorry. So timing rules, it's important to inject PDLLA after ablative or strongly inflammatory procedures. What is the safety profiles? What do we know? So for early, you can have erythema, you can have bruising, edema, tenderness, and vascular events. Delayed, so at week 2 to month 12, so you can have, it's possible, it's rare, but you can have nodules, it's non-inflammatory. Inflammatory nodules, also granulomas, hypo or hyperpigmentation and asymmetry. And of course, you have to respect each contraindication. I presented you just one of my new patients with PDLLA 3 hours after injecting in the teardrops by Juvelook, and she had a voluminous edema. You can also have some bruising, but it's not important. What are the specific complications? So early papules, so it's important to tell to your patients to massage effectively. You have delayed inflammatory nodules. For that, of course, you have to know why, if you have an injection of inflammation or what, but you can use one device, so radiofrequency, to try to move your product. And last, non-inflammatory nodules, so appear after months, and foreign body granuloma, it's another story. You can see here also the effect of granulomas, but it's very rare. For nodule management, so it's important to have mechanical message. So it's the rule of 5. So five massage per day for 5 minutes and for 5 days. So you can use intralesional triamcinolone or 5-FU combined to steroids, and also the monopolar radiofrequency. If you have collagenase, you can also inject and surgical excision, but it's more rare. Some clinical cases you can see. I hope last year I can present my own patients. So you can see with Estetifil or with Juvelook the result. Juvelook on the pores. So it's also interesting. Here, Lenisna versus PLLA. Well, you can compare here on the ligament, zygomatic ligament, and imagine integration. So some results here on the TF-through. You can see what we have a real improvement, and also enhance, it's another indication. What are the limitations? So what the literature does not yet answer. So it's a chorea-centric, so we accepted aesthetic field. There's most evidence on Juveluc Snap power field is single arm Korean case series. So we are waiting to develop it more international. PDLLA produces less collagen than PLLA in vivo. So it's a publication in 2026. No head-to-head comparison between PDLLA products. Conflict of interest in cake publication, so we have to see about that, but there's no data. Take-home message, so PDLLA and PLLA share a name, but they are biologically distinct, so porosity, aggregation, kinetics, volume behavior, all differ. Tissue induction, it's not exactly the same, but we have durable results. Each PDLLA product is unique. Neostimulated reconstitution is very important, so 8 to 9 milliliter of serum physiologic, 24 pre-hydration and vortex, and the technical determinant of safety and efficacy. The combination with IFU, with radiofrequency, microneedling, and lasers are synergistic, but you have to choose the time when you do it, PDLLA after, but not before. And nodule respond to a stepwise algorithm, so massage, steroids, IFU, 5 IFU, sorry, and radiofrequency rescue. We don't have antidote. And it's honest counseling when warn the patients about the nadir, so week 2 to week 4, and set 6 months for results. Thank you very much.
Thank you. Muriel has to go back to Belgium. So if anyone has a question, that's the last opportunity, otherwise you have to go to fly to Belgium.
Yes. But we have Asian population here, so they all know what is PDLLA. So I think
I'm familiar. We will use that in Brazil, yes.
Okay.
So I think it was so well done that it's...
We discovered. Thank you.
And now I have the pleasure to invite my friend from Harvard, Harry Cheng. And be attention because he has an airplane to catch. Everybody like today is leaving. Thank you, Harry.
Thank you. I want to thank the organizing committee for inviting me to join. I'm Henry Chen. My primary academic affiliation is with Hong Kong, but I do hold a secondary appointment at Wellman, and I'm also the past president of ASTA. So in terms of disclosures, I'm one of the co-founders of this technology. So what's new in fractional technology? I want to introduce focal point technology. So one of the main issues when one uses non-ablative fractional lasers among skin of colors is the degree of post-inflammatory hyperpigmentations, which can be rather significant. Also pain. So you have column of injury, and what actually happened is that it damaged your dermal-epidermal junctions where the melanocyte lied, and we know as a dermatologist the degree of inflammatory reaction at the DE junction, for example, lichen planus or cutaneous lupus, you do experience significant degree of PIH. So that's the problem, column of damage. So how do we avoid this? And I would like to introduce a technology that co-founded by myself as well as my two co-inventors, Rox Anderson and Dieter Manstein. So this was published in JED in fact, January of 2025, online published in 2024, but January 2025, focal point technology. So this is what we call a Martina class effect. Rather than column of injury, you have a ring that focus intradermally into the skin. So the energy on top is weak, but when it reaches the dermis, it is very, very powerful, to the extent that US FDA approved 150 millijoule. That's the energy we're using. So you compare with the old technology, a lot of heat deposit too superficially. We now deliver energy where we want it to be. And the volume, the dermal volume damage, is 4 times that as compared with other non-ablative fractional. And we can also change layers. And typically we'll do deep as well as superficial. For younger age group, we can do medium and superficial. Deep, we're talking about quite deep. So you look at histology, 50, 100 millijoule, 500 micron, 100 millijoule, 1,000 micron, and can go to 120 millijoule, 150. This is the device. FDA approval already for acne scarring. And if you look at acne scar, skin of colors, after free treatment, skin of colors, after free treatment, as compared with previous devices, it is much rapid, less treatment session, lower risk. Skin of colors. I mean, we go crazy, you still get PIH, but the risk is just lower. Now, rejuvenation. Skin tightening. Around the eye, the skin thickness is actually very thin. So if you go very, very high energy, you can cause eyelid elevations. So this patient, we look at the eyelid before and after. Before and after. Before. After. Before. After. I did it on my own eyelid, by the way. I did one treatment, but I need 2 more treatment. You need a basic free treatment. Before, after. Well, there's a pigment platform that is kind of on the research stage that we can use to treat PIH as well as melasma. It's a different lasers, different wavelength, but this is something that we are doing. So this is the laser. Now, it also equipped with the dermoscope, so we can also take photograph. You can choose deep and superficials and treat accordingly. This laser is, at the moment, US, I have my own machine, of course. I'm the only one outside US to play with this new toy of mine. So this is my laser that I got it from January. We started to treat some of the patients. If you look at the lines, my own eye, my eye back, before, after second two treatment, before the jowl area, tightening. She is too young. She's my nurse. So you can see the wrinkle, 73 years of age, before. After third treatment, substantial improvement in terms of texture, and these are pretty deep lines. I go very high power on this chap for his eye back. You can see the eye back before, after. She did have some PIH because I go very, very high power. You can see that. Scar. So one of the things that we mentioned in the discussion is the potential. This is JAD, you can just find it online. Is the potential to do what we call smart lasers. So what are smart lasers? We can use OCT or imaging, or as well as a photoacoustic imaging, where you use multiphoton, shoot into the skin, go very deep, lead to ultrasound generation. You can detect it. This is what we call photoacoustic. And we attach into the handpiece, because focal point technology go very deep. We can selectively destroy whatever target we want, which is just an AI equipment. You scan it and tell the laser, I want to hit the sebaceous gland. You don't need another 17 to 26 laser. I want to hit that hair follicle of white hair. I want to remove the white hair. In the past, you cannot do that. We can do it now. Just target on the stem cell. So this, in the future, or skin cancer, scan it. I want precisely 2 millimeters margin. Burn it. And the laser would do it. So ladies and gentlemen, I'm here, one of the reasons because Peter Peng over there put me up to do this meeting in Hong Kong called ISDS. One of my jobs is to promote the meeting, and hopefully you guys will come to Hong Kong. I hope you will see you guys. These are different kind of topic. I have to run because my flight is 4:25. So if there's any burning questions, I'll be glad to reply. Thank you so much.
Otherwise, go to Hong Kong. If
In
there is no
December.
time, go to Hong Kong and ask you
ISDS.
there personally.
Yes.
So,
Can I have my?
okay.
No, come on.
Any questions from the floor?
So here you can go.
Thank you.
Can fly.
Have a
Thank you
safe
so
flight, and
much.
hopefully we'll see you in December.
Yeah. See you guys in there.
See you in December.
Goodbye.
Bye-bye.
Safe
Thank
flight.
you.
So the next speaker, I need not to introduce him because he's a renowned dermatologist and dermatic surgeon from Taiwan, Dr. Peter Peng. He is a president and laser and phototonics medicine society of Taiwan's the executive director and Taiwanese Dermatological Association and director. He's also the Taiwanese Society for Dermatologists and Aesthetic Surgery, and he's the board director of ISDS and the board director of DARCIL. So without further ado, I'd like you to take the stage. Dr. Peng, thank you.
Thank you, Chairman, for the kind introduction. Thank you, the invitation from the INCAS. So I'm going to talk about this combination treatment in the tightening, especially the facial tightening. So this is my position in different societies. For this talk, there's no sponsorship. This concept I presented several years ago in ANWC Monaco. So for this talk is majorly about the skin. How can we tighten the skin? That's a lot of requests from our patient. So we know the facial aging will affect all the 5 layers over the face. So we need to address all the layers, including the bone, deep fat, and some of the space, also the ligament, mass, and the fat, and the skin. And take a look at the sagging. Sagging over here, you can see, especially over the sector 2. That's a mobile area, easy to sag. But if you that may be related to the SMARS and the other tissue, like we know the sliding of the superficial fat pad. So even the SMARS, by this study, MRI study, they study when you lie down and supine and measure the laxity of the SMARS and its correlation with aging. So SMARS do laxity. So we know all this, and when you examine your patient about the laxity, you need to thinking about it's only the skin laxity, the fat pad sliding, all the SMARS are also laxity. Can we solve the problem by one modality? That's the first question. So even by surgery, by facelift surgery, in some of the cases, you cannot solve the problem by only one modality, facelift surgery. So take a look at this good outcome from surgery, from the PRS. So much younger, right? And much lifting. But besides that, this patient also do the fat grafting. So the following issue is another part. You not only treating the sagging, you need to treating other part. Also, take a look at the face, the skin. And also, this patient also done some treatment of the skin. So if you take a look about the synergistic address, you need to address different layers by different modality, even surgically. But non-surgically, we also can use different device, even thread, injection, like toxin and other fillers, totally to improve the thickness. So this is from one of table of my publications. You can take a look of the second part. Second part, you can do the facelift for non-invasive. The right side, you can do many things to treat. Take a look at this from one of the book. Take a look of the jaws. Take a look of the image of the MRI. You can see not only the skin, the fat, the SMARS, all the layers sagging. So that means we need to address not only the skin, not only the fat, also the SMARS. We need to address all these 3 layers, layer 1, layer 2, layer 3. So we know the monopolar RF, this energy can go through the fibrocepta, so it can tighten the skin and the fat. And then the HIFU can even go deeper to the SMARS, and SUPERB, that's a focus on the skin. So, and another technology called HIFANS is targeting the muscle, and with a synchronized RF. So with that, by this study, they measure the muscle tone increase and the fallen shifting, and even the eyebrow higher. So by combination in clinical practice, in my clinical practice, we can use like a SMART to tightening the submental area, you can see, to lifting of the upper eyelid. Another one use HIFU. This is for HIFU, you can see the submental tightening and lifting. And use SUPERB. In some cases, we also can see the submental area improve, the facial shape improve. This patient also, you can see the submental area improve. And also by this particular device, you can see this better jawline before after the treatment. And we always combination of all these device. And but you think about all these devices have different FDA indications. They are targeting different depths. So when you can choose it, use combination wisely, as this study shows, combine HIFU, monopolar RF, either one before and after, have a better result, as like this middle shows. And but thinking about that, the SMARS can from the very upper part to the almost over the neck. You're thinking about the tightening of the upper part can affect the middle face and even the low face. But HIFU need to be careful for the nerve damage. And the monopolar RF combined with HIFU, in this case, you can see the skin quality, facial shape, submental become better. And in this case, combine monopolar RF SUPERB and also the HIFU for the neck, especially submental. You can see this, especially the neck improve a lot. The nasolabial malar line improve. Also, we can combine HIFU with the SUPERB to tightening, lifting, and also improve the skin quality. So, but there's still one missing puzzle. Take a look at the facelift surgery. The last steps, we are cutting the skin. If you have too much skin, you sometimes need a surgery. If you don't want surgery, consider that. This is the last steps of we're cutting the skin and suture in front of the ear, even behind the ear, by the facelift surgery. But this particular device, especially the laser calling mode, I think is quite useful. This is my photo taken by my wife. She persuades me, you need treatment. You need treating your sagging. So this is me treating 3 months after. You can take a look of how tightening the jawline is after this particular device. Even I regularly do the monopolar RF HIFU every year. So I think this is one of the missing parts. So when the patient lie down, you can see some of the patients have too much skin in front of the ear. So that's one of the indication. You can use this particular device. So in conclusion, I think so you can target different depths by combination different device. And don't forget, there's another device we can use for too much skin. That's conclude my presentation. I also want to invite you to Hong Kong for this ISDS annual meeting the first weekend, December 4th to 6th in Hong Kong. With that, I thank you for your attention. Thank you.
You're catching the catch the fly.
Any questions? Everybody's in a hurry today.
Yeah,
Last day.
Yeah,
It's okay.
yeah. Is there any question?
So my only question, quick question, is that it's amazing results. I mean, you already look great anyway, but do you have any problems with PIH afterwards?
This one?
With
The last one.
microcoring, yeah.
The microcoring.
Microcorin, yeah, but for the, I think so, I must say, PIH can happen if you use a very aggressive setting. And the PIE can last a couple of weeks, depending on the patient's skin type and how aggressive you go. But it will go away. And I usually treating the submental area. That's a relatively heating area. Yeah. If you are shorter than me, you can see like this. So the treatment. But after a couple weeks, it disappears. Yeah.
I'm not afraid of post-inflammatory hyperpigmentation. I'm afraid if it would happen hypopigmentation.
Hypo.
Because
Never,
we can treat it.
yeah, hypo,
Yes.
we never encountered
That's the
hypo.
problem.
Yeah.
And I noticed that just taking something to decrease the inflammation, like omega-3, you can decrease the incidence of post-inflammatory, just decrease the inflammation. maybe.
Yes, also you can use like exosomes,
Yes.
use other ingredients
Something like
immediately after the laser.
Good
So
idea.
you can reduce the inflammation, also reduce the risk of like a PIH. Yeah.
Thank you very much.
Thank you.
Thank you. Thank you.
And now last but not least, we have a problem here. You can come.
Sorry, Dr. Arun Garg Tiwari, would you like to come up to the stage? I'm so sorry, I would love to introduce
Computers
you, but
problem.
it's
Technology
it's
problem.
not working.
Okay, it is.
Thank you for coming.
Very, very
Stay
good.
with us.
Not at all.
Do you have
Have the best
a
for
plane
last.
to catch?
I don't have a plane to catch. A disclaimer. So I'm here, and I love to be here in IMCAS, and it's always a great pleasure to talk about lasers. The passion, the love affair goes on. Well, so one of my latest devices is the 1470 diode, which I have picked up. And it's a beautiful device. I'm just going to take you through what it can do and where all I use it. Well, we are all seeing the rise of minimally invasive aesthetic procedures. All the previous speakers have talked about it, doing various layers with different lasers so that to give the tightening, to give the lifting effect. So the transition from surgical to energy-based solutions is happening slowly, surely, and it's coming there. So it actually bridges the surgical and the non-surgical technologies. What it does is, it's a subdermal laser-assisted tightening. So we go inside, go into the dermis, go into the subdermal level, and then deliver the energy instead of hitting the epidermis. I'll tell you how to do it. And we do the lower face, jowls, even the neck laxicity. So all these things can be targeted by the single device. It's strongly absorbed by water and fat. It's got very high affinity for collagen tissue, and there's no or almost minimal carbonization, charring, etc. It does not happen. It's very, very controlled thermal heating. So we go from target chromophore of fat and water. So we're doing the collagen, we are removing the fat, and as well as we are collagen remodeling will give the lifting effect to the patients. So you're destroying, you're creating in the same technology. And that's how you create a well-contoured face. What happens is, it's a very, very penetration depth is limited, 2 to 3 millimeters. Thermal range for collagen tightening is 60 to 70 degrees centigrade, and 80 to 100 degrees is what is required for the lipolysis. So it's a dual benefit which I just talked to you about. Fat removal and your collagen tightening. So, well, this is a very interesting chart which I always like to show whenever I'm talking about this particular technology. The laser physics, the temperatures are something very, very important while we are targeting, because heat can destroy, heat can stimulate, heat can be productive when you use it correctly. So it's delivered by a micro cannula, and it does affect the subcutaneous tissue. Collagen denaturation happens. You get an immediate contraction as soon as the patient gets up from the table, and you see that contraction which is there. And of course, you have the long-term fibroblast stimulation, which results in lifting and lightening. So minimally invasive, precise target, natural results, no distortion, short duration of action, and combined with either lipo or with fillers. Now, these are very, very good indications to have, mild to moderate. Of course, severe cases, what my earlier speaker, Dr. Peter said, you need coring, etc. You need to remove the skin for extra laxity. So this is a device which will not remove, but tighten. Local anesthetic, OPD procedure, temperature monitoring is there, reduces risk of burns, necrosis, and very minimal bruising or neckling. Now, this is where it gets a little complicated, / we should know anatomy, and this is once again anatomy. The treatment zone has been well defined here. You can see the colors there. And so you mark the areas properly and then go ahead. Now these are all clinical photographs, so please do not take any pictures. I'm thankful to you for that. And these are results after single treatment. You can very well appreciate the kind of jowls. Everything is gone here. Look at the laxity, the neck lifted after, neck after. Once again, these are very, very trouble areas. You know, we are always foxed with this particular area without surgery. You need to put in injection lipolysis, you need to do other things, but here in a single session you get these kinds of results. It can be repeated after as well in patients who need it after 6 weeks, 8 weeks or something, but then most of the patients are pretty happy with the kind of results. You can tighten the lax areas in the arms and abdomen, other areas as well. Look at this, all the lifting which is happening, all the lifting which is happening. The wrinkling, everything. The skin looks much, much smoother, much, much better and lifted overall. Look at this once again. Single sessions, overall improvement. So it's also used for scarring. You can go a little superficial with the cannula and destroy the scars. So you can have very good results in scars as well. So facial fat reduction, lots of papers now, pretty safe to do. It is not a replacement for severe cases, requires a little bit of skill as compared to other technology because you're inside, you need to be at the correct plane, so not to cause scarring, not to cause burning, and it gives best results in mild to moderate laxity of the patients. We are combining therapies with PRPs, exosomes, RFs, expanding indications are coming in. We've already started doing arms, abdomen, everything. Regeneration is once again which we are looking at. So it's a science-backed advancement. It's very safe, very effective, minimally invasive. And this is what the laser light looks like when you are inside the skin. So you know where the laser pointer is, and then you keep on just targeting. This is a very dear friend, Dr. Friend Rathore. He's doing the procedure here in this particular slide. Even labioplasty has been done by him, Dr. Vikram Rathore. He's doing labioplasty using this particular device. I have not done it, but these are his patients. And it's very, very good to have safe, precision-based treatment for these particular areas as well. So you have fine sculpting capability for tailored labial reshaping also, improved contour, proportion, symmetry, non-surgical, and it gives excellent results. So this is how you operate once again. The cannula goes inside. There's a special cannula for the vaginal area, and you tighten that particular entire tissue. And no surgery needed. It is just, once again, ablation, intradermal ablation. So this is also lots of genitourinary incompetence, everything has been treated with this device. So I thank you very much for the patient listening. In case you have any queries, in case you want to connect, these are my contact details. I thank you very much for the patient listening.
Thank you very much.
Thank you. You can stay because is there any question for him? I do have a question for you. When you treated on the face like acne scar, are not you afraid about the fat if like the patient has some like over effect?
Yeah, you're right. But like I said, you need to be at the correct depth. The light is actually, once you start doing this procedure, the intensity of the light can very safely tell you where you are. And then
Visually you can see it.
you can always see it. The red light is an indication. It's meant to be, you have to visualize which plane you are. So the light guides, it's a guide wire. So the light goes in, if you're too deep, the less light will be there. If you're too superficial, it will be a very bright light.
I see.
So that gives me an idea. Next time I'll put in a video of doing the two procedures at a different depth. So very, very easy. And then you decrease the power. So once you decrease the power and you're in the superficial layer, it is just like I'm just doing a subcision. So RF subcision, laser subcision. So this is like a laser subcision, which I do in the scars.
But there's no sensor for the temperature.
Sorry?
There's no temperature sensor.
No, not a sensor of temperature, but you can reduce the temperature.
So there's no temperature. So you
No,
can't
no.
be sure how hot it goes.
You have it on the screen. So you decrease the power.
There is
Oh, of course,
a
of course.
sensor.
She's asking about the measurement from outside.
But you want how many degrees centigrade? No. But the power, yes. You decrease the power. So once you decrease the power, the power goes down, and then you can just easily subsize that particular area. So very handy device. That's why a little learning curve. It is not just the moment you have it, you should not go into the superficial plane. You should handle it, go down to the submental area, and do all the fat areas. And then you start playing around. Once you start to know how the cannula is being guided, it's a breeze. It's
So
a
we
beautiful.
started by outside the face, and then they're gonna really good. Then we start doing the face.
Absolutely, absolutely.
Any more question? Good.
What sort of anesthesia do you use for this patient? I know some people are using tumescent anesthesia, but I would argue that if you use tumescent anesthesia, you're heating the anesthesia itself. So what sort of anesthesia do you use for
You're
the patient?
absolutely right that there is a possibility that you're going to heat the anesthesia, heat not the tissue, but the liquid, the fluid. Now, when you don't use a lot of fluid. The tumescent anesthesia is not like you don't bloat it up. You just put in micro droplets.
Okay.
Now what I've started doing is doing the blocks. So I do the infraorbital one, I do the mental, and the preauricular. So that gives me a very, very decent amount of anesthesia in the entire area. Of course, we apply a top lap also when I'm doing the superficial anesthesia.
Yeah, and I have another question. So you've got great results over there, especially for the submental area. Did you perform any liposuction along with the 1470 treatment with 1470 laser treatment, or is it just the 1470?
No, these results are only the 1470. But a few of my plastic surgeons actually, when they want quick results, so once you've destroyed the fat, you just pull it out. You do a liposuction, and they're doing that.
So it's fiber,
Fiber?
liposuction, and fiber.
Yeah.
Okay.
Lipo, fiber, lipo.
Okay, and one more question, if that's
Yeah.
okay. When we're talking about intervals and how often do we do it with this, when do you think that the patient actually needs more treatment, and how long until you wait until you decide that, okay, I think this patient needs the second or third treatment?
Right. So most of the patients do not need the third.
Okay.
Because then if you need the third, that means that you chose the wrong patient. The patient was actually meant for surgical intervention rather than the laser. So the second treatment, few of them require, but when I got it, I used to look at 4 to 6 weeks. But then in few patients, I found that I was very quick in redoing the thing. So now I wait at least 8-10 weeks.
10 weeks.
10 weeks is what I usually now hold on to.
Okay, thank you so much.
Not at all. Always a pleasure.
And do you use other lipolysis as well? For
Sorry?
the injections, do you use any lipolysis?
No,
in
not with these
combinations, or
patients,
it's
not
just-
with the results which are there. But
What in practice?
I did use lipolytic injections earlier, but the lipolytic injections give you a turkey neck. There's a lot of ecchymosis sometimes, a lot of fluid gets accumulated. It's an irritant. It causes a burning pain to some patients a longer time. So I find this a safer, better option wherein I can tighten the skin as well along with the leg. Yep, please.
Do you have experience in removing the intraorbital fat using this laser?
Yes. It is. I started doing it for the intraorbital, and it is doing good results.
So do you need
The eye shield? No, you're not there. You're
is this U-photon?
sorry.
Is this U-photon?
It's 1470.
The device, the name
Oh,
U-photon, is it U-photon?
It's got multiple names now. It's a microlift is there. Then the one which I'm using is called as microlift only. And then there are lots of devices. There are lots of devices which are there in the market now. Thank you very much. Thank you.
Thank you. Well, I think that was very interesting, wasn't it, with different...
Thank you, the audience, for staying with us. So, finish.
Yep, okay.